Good morning. On behalf of the Border Solutions Alliance and the West Big Data Hub, thank you very much for joining me for this lightning talk today. During this talk, I'm going to provide an overview of COVID-19 data in Mexico, along with a hands-on explanation of how to work with the data and some of the limitations of the data set. In addition, I'll provide some background on historical mortality data in Mexico that gives us context for this COVID-19 data. Mexico is a country with lots of data. For example, you can find historical data on all registered deaths at the individual level and all hospitalizations at the individual level as well. In the coming years, this will allow researchers, policymakers, and practitioners to understand the impact of COVID-19 on particular places, age groups, genders, and by comorbidity. This is a very important tool for understanding health equity, or a lack of health equity. I've included here a definition of what health equity means. The Robert Wood Johnson Foundation provides this definition. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. This requires removing obstacles to health, such as poverty, discrimination, lack of access to jobs, fair pay, education, housing, safe environments, and healthcare. And this is particularly relevant during COVID-19 when there are particular parts of the population that don't have access to healthcare or that don't have the ability to stop working and have to put themselves at greater risk. Mexico makes all of the data on COVID-19 tests, cases, hospitalizations, and deaths available by state and by municipality. The database is administered by the federal government and it's available online to download. There's roughly a 2-week reporting lag for all of the data to be fully up to date. And so I would suggest when working with this data that you look at the data up to perhaps 2 weeks before today. There's a dashboard that allows you to interact with this data. And in that same place, you can also download the data. In addition, there's a data dictionary that explains all of the variables in the data set. This is the dashboard itself, and so you can see here that the dashboard shows the number of cases that are positive at the over time, the number of deaths, the estimate of the active cases, and it also shows the number of hospitalizations and negative cases as well. It's listing this information by gender, also including the kinds of comorbidities that patients have. And it lets you break this information down by state. It also breaks the information down by day. You can access the information by municipality, and you can also see the ages of people that are impacted, and as well as the gender of people who are impacted for those who are hospitalized and for those who are not hospitalized. In the coming days on our website, you'll be able to find a download of this data with a translation of the data dictionary into English. You can also download the data yourself, and so it's really up to you whether you'd like to download it directly or not. The download is here in the dashboard that the Mexican government makes available. So you simply have to go to Descargas or Downloads, and then you can choose to download the cases by state or by municipality. And I suggest downloading the data set with where it says todos los datos, or all of the data, because that's the data set that will have the individual cases. And basically what's being recorded in this data set is tests. So every time a test happens, it becomes one observation in the data set. And then you're being told if the test was positive or negative. You're being told if the person who had that test was hospitalized. You're being told if eventually if that person died of COVID-19. You're also going to be able to see If they were using a ventilator in a hospital, you're going to be able to see what kind of hospital they were in, which of the hospital systems. You'll see their age, you'll see their gender, you'll see information on where the hospital they visited is located or the health clinic that they visited is located, as well as information on where they live. And so it's a very, very rich data set and enabling people to understand what the trends in COVID-19 look like across the country. I would recommend, if you wanted to work with this data set, using something like R, Stata, SPSS, or something similar, because the data set is quite big. For people who are more comfortable using Excel or Google Sheets, we're going to make a version of the data available that has just the Mexican border states, so that you can work with a slightly smaller data set if that would be easier for you. Now, one of the biggest criticisms of this data is that it's underreported. And so there's been a lot of information coming out in the press and coming from the government directly, talking about the issues of underreporting and the magnitude of underreporting in the data set. That said, the data set is very good for understanding trends. And so I'm going to show here now a graph of excess mortality by week in terms of how much excess mortality COVID-19 represents. And I'm just showing a couple of states here. So we have Baja California, Campeche, Mexico City, Sinaloa, Tabasco, Tamaulipas, Zacatecas, and then the brighter red line is the national data. And what you can see here, I'll just make it a little bit bigger so that you can perhaps see this better. Okay, so what you can see here is that over time, by the week of June 29th, at the country level, COVID-19 deaths represented 30% of normal deaths, of the number of people that normally would have died in that same time frame. And so that gives you a way to understand how significant the COVID-19 mortality is as confirmed by deaths that had tests. So all of this data is people who both have a positive COVID-19 test, that positive test is in the data set, and that that the death is recorded in the data set as well. And using that data, which is some of the best data available, what you can see is that by the end of June, the number of recorded confirmed COVID-19 deaths was 30% of what normal death would have been as compared to 2018. And in some states like Campeche, Tabasco, Sinaloa, you can see that their data was showing us that excess death because of COVID-19 was something like 60%. And this is not taking into account people who might have died of COVID-19, but there wasn't a test to confirm that. It's not taking into account other people who might have died indirectly because of COVID-19, for example, because of mental health issues, because they were not able to access a hospital, because for other non-COVID ailments, because they didn't have access to their medicines because of economic reasons. All of those kinds of things are not recorded here. This is only the excess death related to the cases of COVID-19 captured in the federal data set with a test to confirm that they were positive. And so sometimes it's hard to really understand what this means. And this chart can help you think about how significant this mortality is. So what I'm showing you here now is what the impact of 100,000 COVID-19 deaths will look like by age group. So all of the data in this chart is the mortality in Mexico from 2018. It's all of the deaths that were registered in Mexico in 2018 by cause of death. So you can see all of the blue causes of death are things like diabetes, cancer, all of the non-communicable diseases. Then in red, you have injuries. So you have unintentional injuries, traffic injuries, intentional injuries. And then above in green, you have deaths that are diarrhea, neonatal, nutritional, and all of the communicable diseases as well. So the bright green is what 100,000 extra deaths related to COVID would look like. Along the bottom, you have age groups, and so you can see that this is going to be a very significant cause of death for middle-aged people, as well as and much less extent for older people. And then you can also understand a bit better if you look at the mortality rates and the years of life lost, how COVID-19 is going to compare to other causes of death in Mexico. So this is all 2018 data. In 2018, the mortality rate, for example, for cancer was 76 per 100,000. And so that means that out of every 100,000 people in Mexico, 76 of them died of cancer. And on the left-hand side, you can see on average the number of years of life that were lost for each one of those cancer deaths. So 21 years of life were lost for each cancer death when you're comparing the age of the people that died to their life expectancy. And so basically what you can see when you look through this lens is that if Mexico were to have 100,000 COVID-19 deaths, that would be a mortality rate of 80 per 100,000, very similar to cancer, also similar to adding up all of the injuries, traffic, intentional and unintentional injuries, and that the years of life lost for each one of those deaths on average would be similar to the years of life lost for diseases like cancer. And so this helps put the statistics that we've become very used to seeing every day in context that helps you understand what the scale of these statistics means. And just a tiny bit of background on how this data is gathered when we're talking about the historical data. There's a death certificate, and it gets filled out at every death. It includes lots of information like gender, cause of death, date of birth, where the death happened, and it includes an ICD-10 code. And then what I did for the data that I'm showing you is I recoded those ICD-10 codes using the global burden of disease classification, which just makes it a little bit easier to understand what the causes of death look like. And so I'll share this PowerPoint presentation with everyone who's attending after our meeting, and I'll also it'll also be available online for people who are watching this video recorded. But basically, to recap, the COVID-19 dashboard that the Mexican federal government has is a great place to go if you want to interact with the data and the data visualizations. You can also download the data set of all the data that you're visualizing there. There's a data dictionary that helps you understand what the data means. And then I've also included an article that provides more background into all of the discussion that I was sharing with you today. And you can see some interactive maps with the historical data at the link that I'm providing as well. And I just want to spend a few more minutes talking about underreporting before we move into questions and answers. And so, as I mentioned, we have something on the order of 65,000 confirmed deaths in Mexico in the federal data set. But many people have pointed out that this is probably vastly underreported. And we will be able to really understand that underreporting once all of the data is available in a couple of years, or in a year and a half. But in the meantime, there has been a lot of work done to understand the biases that we're seeing and the underreporting that we're seeing in that data. The government has explained some of the underreporting that they're seeing. And then other researchers have taken a crack at this as well, using, for example, death certificates in Mexico City that are available online, using some data on ambulances and the use of ambulances and the out-of-hospital deaths in ambulances in Tijuana. And so if you're interested in better understanding the COVID-19 data and some of the limitations of that data, I would point you to these resources here to better understand that. And so with that, I'll go ahead and I'll open the floor up to questions and answers. If you have a question, you can put it in the Q&A, or I think you can raise your hand, and I'm happy to give you the microphone so that you can ask your questions there as well. Hi, Adan. Let me see if I can give you the microphone. All right, there you go. You can unmute yourself and let me know what question you have.
Okay. Okay. Hi.
Hey.
I was just wondering if the data set does include information on the whereabouts of the patients. Where do they live?
It does. So the Mexican data set has information on the municipality and state of residence of the patients. It also has information on the location of the hospital or clinic where their test was done, both geographic information as well as I think it also includes what health system that particular health institution belongs to. So it would tell you if it was, Eames or East Day or what kind of clinic or hospital the test was done in. And it's meant to include all of the tests, both tests that are done in the private sector medical institutions as well as in the public sector medical institutions. So it's a very interesting data set. It has the limitation, of course, of underreporting, but it has on the positive side, you can see all of the data, every day throughout the country. Like I mentioned before, I suggest working with the data. There's about a 2-week lag, so not working with the data from the past 2 weeks, but working with the data from before that. And depending on how comfortable you are with data analysis, you might not want to work with the full data set, and we'll make a smaller cut of the data that just looks at the border states available to participants, but otherwise you can download the full data set online anytime.
Okay.
Thanks for your question. Yeah. Any other questions before we close the talk for today? All right, well, thank you very much for joining, and we'll post this online so that you can have access to the links later on as well. All right, thank you and goodbye.